I'm Mark McShane, Doctor of Physical Therapy, coming to you from the Body Rebuilders Physical Therapy Clinic in Bala Cynwyd, PA. And today we're going to talk about pain during activity and exercise. When is it too much and when is it time to back off? So if you're an athlete, you may have been told that you need to push through pain. No pain, no gain. If you're not an athlete, you may have been told that exercising involves some amount of pain. And while this is true in some respects, we have to be cautious with how much we push through pain because sometimes it can be counterproductive. So I'm going to give you a couple tips that I use and I encourage my patients to use when monitoring pain during activities or exercise. An example of an athlete pushing through pain might be a runner. It's a really common phenomenon for runners to be able to run it out, meaning that they start their run, they feel some aches and pains in the muscles or joints, but then as they keep on going, the pain becomes less and less. And you might also experience this when you're doing your regular routine exercise. In fact, we want to use exercise to help decrease your pain. But a couple questions that you can ask yourself may be useful in determining if you're doing too much, or maybe if you're not doing enough. Question number one is, how intense is the pain? You may have been asked in the past by a medical professional to rate your pain on a scale from 0 to 10. 10 being the worst and 0 being no pain at all. And I'm going to let you in on a dirty little secret. This pain scale is terrible. Nobody, and I mean nobody, clinician or patient, likes the 0 to 10 pain scale. It does have some uses, because if you wake up in the morning and your pain is a 5 out of 10, and then as you move around a little bit more, it goes to a 3 out of 10. That's wonderful. That was a change that we can measure subjectively for you. Your pain went down. But the catch comes that your 5 is not my 5, is not someone else's 5. And so the designation of 5 out of 10 doesn't mean much unless we give it something to compare it to. Right? But let's say that we're going to try to use this pain scale very loosely. It's safe to say that a 1 to 3 out of 10 pain is different than a 5 to 7 out of 10 pain. And so we're going to use that idea, that concept of a kind of mild ache and pain that you would rate on the 1 to 3 scale to something a little more significant like a 5 or 6 or a 7. If you're exercising or performing an activity like walking or standing and you get a 1 to 3 pain, generally, as a rule of thumb, it's okay to keep doing what you're doing. Most of the time we have to push into a little bit of discomfort if we're going to do something productive, and it doesn't necessarily do you any favors to completely avoid all things that cause any discomfort. 1 to 3 is normally, for most patients, a safe zone to be in. We're exposing your body to a stress that is uncomfortable, but we're not doing so much that it's really working up. And if you're performing an exercise or an activity and you start feeling it go from 1 to 3 up to a 4, 5, 6, 7, 8 or beyond, you definitely want to slow down, modify the activity, or take a little bit of a rest break. Question number 2 is, how long does the pain last after you stop the activity? This is what we refer to as your pain irritability. How much does it take to work your pain up, and how long does it take to calm down after you stop doing what you're doing? If your pain is more irritable, meaning that it doesn't take very long for it to work up on you, and after you stop and take a rest, it stays with you for a longer period of time, then we want to back off of the activity a little bit. The goal of exercise and activity is that you feel good after you do it. You feel like it was something productive. And feeling a little bit of aches and pains is normal, but you shouldn't feel worse off than you were before you started the activity. Especially within 15 to 20 minutes, you want to let things calm back down again. And this brings us to question number 3. Question 3 that I ask is generally, how do you feel that night? How do you feel the next morning after you participated in whatever exercise or activity that is difficult for you? If you were flared up that night or you're flared up the next morning, you probably did too much. And we have to dial it back a little bit and reduce your activity so that you can appropriately recover from it in time for the next day or for later on that evening.